Hello, my name is John Serrano from the Health Workforce Technical Assistance Center, bringing you another ArcGIS tutorial. You can find all our GIS tutorials on the HW Tech YouTube channel. Please like the video and subscribe to stay up to date. You can find the rest of our content on our website at healthworkforceta.org. In our previous tutorial, we allocated county-level COVID-19 data into smaller geographic units using population weights. As a result, we now have the ability to reconstruct the COVID-19 data into larger geographic units that match a desired study area. In this video, we will reconstruct the data into new geographic areas known as health professional shortage areas, also known as Hipsas. While I'm sure everyone is aware of COVID-19, you may not be familiar with Hipsas. Hipsas are federal designations that indicate there is a shortage of healthcare providers in a specific geographic area. Hipsas are determined by a variety of factors, including the number of providers in an area compared to its population, and different population characteristics such as poverty rate. There are different types of Hipsas, but today we are going to focus on primary care Hipsas in New York, which will be referred to as Study Area 1. Primary care Hipsas imply that there are not enough primary care physicians in an area to adequately meet the needs of a population. Areas that are not primary care Hipsas will be referred to as Study Area 2. In this video, first, we will introduce the datasets that we will use to create the study areas. Second, we will discuss the geography of health professional shortage areas. And third, we will process the data to create the study areas using ArcGIS. So let's take a look at the data. We will use the COVID-19 case surveillance data, which includes total number of COVID-19 cases and deaths resulting from COVID-19 in New York State in 2020. The data was downloaded from the Centers for Disease Control and Prevention's website and converted to a sub-county level using population weights. Please watch the video on how to allocate county-level COVID-19 data into census tracts using population weights for more information on the data and the methodology used to create the population weights. For more information about COVID-19 case surveillance data, visit the link in our description box. The second dataset we will use contains information about primary care Hipsas in New York. The dataset was downloaded from Hipsas Data Warehouse. Please watch the video how to connect Hipsas Data Warehouse to ArcGIS and extract data for more information on Hipsas Data Warehouse. In short, Hipsas define the boundaries of the study area, as well as represent areas with insufficient health workers. These study areas will allow us to examine the number of COVID-19 cases by a variety of factors. However, in this video, we will focus only on creating the study area. In future videos, we will examine COVID-19 cases in study areas 1 and 2 and compare different variables to identify associations between high rates of COVID in each of them. It is important to understand the geography of Hipsas before we conduct any analysis with the data. Primary care Hipsas are composed of components, which can be a county, one or more townships, or one or more census tracts. Hipsas that cover whole counties are typically located in rural areas. Hipsas composed of townships cover mid-sized cities. And Hipsas composed of census tracts cover parts of major cities, such as New York City. Therefore, the geography of Hipsas varies based on the components, counties, townships, and census tracts. Let's explore the dataset of primary care Hipsas and review their components in ArcGIS. In the table of contents, we have a New York primary care components layer representing all the primary care Hipsas in New York State that are currently designated. In the attribute table, each row represents a component of a Hipsa. A group of rows with the same Hipsa name represent a single Hipsa. For example, after we sort the table by a designation name, we can see all the components of Buffalo's city service area. In this case, the components are census tracts. If we sort the table again, we can see another example of a county-level Hipsa that has a single component representing a county. Now that we understand the data that defines the boundaries of study areas, let's review the dataset containing COVID-19 cases. This Excel file contains 3 sheets of data on COVID-19 cases in 3 levels of geography: census tracts, townships, and counties. Let's start with the first sheet. Each row represents a census tract. We can see the population per census tracts and the weighted counts of COVID-19 cases using population weights. Again, please watch the video how to allocate county-level COVID-19 data into census tracts using population weights to learn how to create this dataset. We also applied the same method to the second sheet, which are townships. Finally, in the county-level data, the counts are not weighted since the original data wasn't a county level and no breakdown was needed. It is extremely important to have the data available in all three geographies in order to successfully join datasets containing different levels of geography, such as our Hipsas dataset. Now that we understand the structure of the data, let's create the dataset for Study Area 1, Primary Care Hipsas. We will join all three datasets containing counts of COVID-19 to the Primary Care Hipsas dataset. This join will be done 3 times, 1 join for each level of geography. Let's start with census tracts. To do this, we imported the Excel file containing COVID-19 data into ArcGIS as shown in the table of contents. To join, right-click the Hipsa layer, select Join and Relates, then Join, select Join Attribute from a table, and select GeoID, which will be the field we use to join both datasets. Choose the COVID-19 cases by census tracts for the table to be joined. Choose the field CTGeoID to base the join on. Keep the default setting for the join options and then click OK. Once the join is completed, we can see that the attribute table has 2 new fields containing the population and the weighted number of COVID-19 cases per census tract. Repeat the same process for both datasets, COVID-19 cases by township and by county. We can see the fields that were joined containing the population and COVID-19 in all geographies. Let's export that layer to save those joins. Remember, joins are not saved unless you save the layer. Please watch the video How to Add Zip Code Level Medicaid Enrollment Data to a Primary Care Hipsa to learn how to join datasets in ArcGIS. Now that we have the layer saved, we can remove the original layer and the COVID-19 cases datasets from the table of contents. Now, let's sum all the fields that were created from the joins so that there is only 1 field left representing the population and another field representing COVID-19 cases. To do so, we need to create those fields, open Attribute Table, open Table Option, Add Field, name the new field Population, select Double for type, and click OK. Repeat this process for the COVID-19 cases field. To sum columns together, first, we must replace all cells with the value null to 0. To do so, make that layer editable. Click the editor, select Start Editing, open Attribute Table again, and we will start replacing nulls in the CT population. Right-click on the field name, and select Field Calculator. Select Python in the Parser section, and check the Show Code Block checkbox. We will insert a code into the pre-logic script code box, which will replace nulls with zeros. And we will insert this code into the second box and replace field name with the field name from the other fields list. Finally, click OK. We will do this for all other populations and COVID-19 case fields. Next, click Stop Editing and save your edits. Open the Attribute Table again, right-click the Population field, which will contain the total population based on the other population fields. Open the Field Calculator, select VB Script for Parser, and add all the fields that contain the population in each geography level from the field list. Use the plus sign to sum the fields, then click OK. Repeat the same steps to sum all the fields with COVID-19 cases. Now we see that the total population and the total COVID-19 cases for each component. Next, we will combine the components by Hipsas, so we have the total population and COVID-19 cases per Hipsa, even if the Hipsa is a county, township, or a census tract level. We will use the dissolve tool, which allows us to combine the statistics of a group of components with a common value. To do this, click GL Processing on the top and select the dissolve tool. In the new window, select the PC Hipsas with data layer, the layer in the table of contents, in the input field. Select a folder for the output. Then select the name of the field containing the Hipsa name, since it is the common value between each group of components. Finally, in the Statistics field section, select the fields that will be combined. Since we are interested in aggregating the population and counts of COVID-19, we will select Population, which represents the total population per component, which represent the counts of COVID-19 cases. Once the appropriate fields are selected, we will select the type of statistics that will be applied on the data when the dissolve process is executed. Let's select Sum for the statistic type and click OK. This will sum the counts per Hipsa. After the dissolve process is completed, we can see that the components with the same Hipsa name were dissolved together. In the Attribute field, we can see that the counts were aggregated by a Hipsa name. On the map, each area represents a primary care Hipsa. Next, let's review the datasets for Study Area 2, which were prepared for this video in advance to save time. Study Area 2 covers areas that are not designated as primary care Hipsas. Study Area 2 contains whole counties and partial counties that are not designated as Hipsas. Since there are a number of sub-county Hipsas, we must include the parts of those counties that are not designated in Study Area 2. These areas are visible in urban areas such as New York City. For example, we can see that parts of Queens County are designated as Hipsas and belong to Study Area 1. The remaining areas of the county that are not designated as Hipsas are part of Study Area 2. It's important to note that Study Area 1 should not overlap with Study Area 2. We now have two study areas composed of different geographic units with data on the number of COVID-19 cases joined to each. This approach provides the flexibility to join, overlay, and compare other datasets and variables representing different factors that can contribute to high rates of COVID-19 cases. Also, it is possible to examine how each study area differs from each other by various factors such as poverty. The methods used in this video can be useful for other research involving study areas composed of different geographic units. However, it is important to understand the limitations when using this approach. First, the method we used to convert county-level data into census tracts in the previous video assumed that the cases of COVID-19 were geographically distributed the same as general population. This assumption may not always be true. While we know that the cases of COVID-19 are associated with the geographic distribution of the population, other factors, such as income and education level, may also impact the distribution of cases. Caution should also be used when calculating rates between two datasets if one dataset was used as the base of the weights of the second dataset. In our case, calculating rates of weighted cases of COVID-19 by population counts that were used to generate those weights will not necessarily provide meaningful results. To recap, first, we joined COVID-19 data to each of the three geographies of primary care Hipsas in New York. Second, we summed the counts of all three geographies in primary care Hipsas into two fields representing the total population and total cases of COVID-19. Finally, we combined the primary care Hipsa components using the dissolve tool in ArcGIS to generate the study area 1. If you have any questions regarding the content of this video or need further assistance, please contact Nafin Harun at nharun@albany.edu. Subscribe today to stay up to date on future tutorials and the rest of HW Tax content. Thanks for watching.